So welcome to this video too, where you will learn all the secrets, or at least as many as those applied by Marco. Therefore, all the things that are put into practice by Marco every day, and not just theory of what you can do. So now, explain to us, Marco, step by step, so that you can comment on these images of releasing and manipulating the sacrum. Hence, as you told me before, all the various facets of what you can do to step in to improve certain situations. So,
Yes, exactly. This, in a more specific way, of course, relates to a particular manipulation. Therefore, it is a manipulation of the sacrum, which can be used in case of anterolisthesis, or anteriorization of the sacrum. However, first of all, you have to know that there are additional contraindications regarding absolute contraindications for manipulations. Okay.
which is why we dedicate them a separate video. So,
Yes, there will be a specific video. However, since there are additional contraindications, I want to tell you briefly which they are, okay? Obviously, you can apply this manipulation on all patients that probably are healthy but don't have particularly severe osteoarthritis of the hip, don't have hip replacements, patients who aren't pregnant, and of course, who aren't obese. Now you'll see why. Actually, you're already seeing it, precisely because this manipulation involves a fairly significant mobility. Therefore,
abdominal compression too.
absolutely, yes. Well, it's a manipulation that can also be used in cases where the patient has got, in fact, an anterolisthesis and an anteriorization of the sacrum. This is called a drop down, a manipulation where you drop. Okay, so you aim the forces in the opposite direction. Hence, in the case of anterolisthesis and anteriorization, of course, you direct them to the posteriorization, and it is really effective in cases where maybe other manipulations don't give good results, right?
Does it create cavitation also in this case?
Well, let's say in my experience, I can tell you that this is a manipulation that I don't use often. There can be cavitation. However, of course, you know that we are talking about the sacrum. That isn't a vertebra.
Movable.
Very movable. Yes, that's right. These aren't movable, such as lumbar vertebrae. They are fused together, so there may be cavitation. Yes, there may be, but rarely. For this reason, I tell you, of course, if you perform it by long lever, so you give it a greater angle, obviously, you can also feel a cavitation, which, however, isn't of the sacrum. I tell you now, but it's of the lumbar spine.
Question, but do you create at least some kind of decompression in that area, where, for example, it was an extremely compressed area?
Absolutely, yes. It creates a decompression. For this reason, in fact, actually it is the feedback, the greatest benefit that can be, right after the manipulation. So to properly perform this manipulation precisely, the patient lies supine. You ask him to bend his knees towards his chest.
Wait, I interrupt you. Forgive me. Let's put it in a slow motion, so we explain it step by step. So now, Marco, just step by step, explain to your colleague who is following you, what do we have to do?
Well, you position. Of course, you ask the patient to lie down, belly up. You ask him to bend his knee to his chest. You're positioning yourself with one hand in contact with the sacrum. Okay. Then you just wrap the sacrum with one hand right through the gap between the thenar and hypothenar areas. Okay? The other hand is above the knees. You put yourself in position so that you can press his two knees with your chest. In this way, as you see, once you find the barrier by pulling the sacrum upwards, you're going to do the drop down. So you just let yourself fall down, okay? This is the drop down.
Okay, I think it's very specific. One last thing, just to be safe. Now there will be a change of image, and if you could comment exactly this image too, with this side view.
Okay, do you see it? There is the bending of the knees towards the chest. I'm going to put my hand right through the gap between the thenar and hypothenar areas and between the sacrum, right? Then I pull it.
Upwards.
Upwards, exactly.
In the movement of compression of the knees downwards with the right hand, is there sacrum upward traction too?
Yes, indeed, and it is at the same time that I pull upwards while I compress the chest to the bottom.
Okay, and when there is the thrust, is the hand that surrounds the sacrum fixed or does it pull?
No, simultaneously it does the same thing we did to find the constriction barrier. So I simultaneously compress and let myself fall down, and of course I pull the sacrum a little bit up.
Okay, great, very good.